Hi there, my name's Dr. George Olstein and I welcome you to my ongoing video series called What's Achievable in Dentistry. In today's video I want to talk to you about a very common problem, and that's impacted wisdom teeth. Now, wisdom teeth are the last teeth to erupt in the mouth, and they usually happen between the ages of 18 to 25. And that's when people do develop symptoms of pain. And it happens because our jawbone or jawline is a lot smaller than it can accommodate. This is a model of a lower jaw, and that's where most people have problems, is with their lower wisdom teeth. Now this represents, this part of the mouth which is sort of going from this area here to around here. This part is called what we call the ascending ramus, and the problem lies because the distance from here to the midline of the jaw has become smaller over many millions of years. In fact, if you look at prehistoric man, you'll find that his jaw line was a lot longer because his diet was different and needed all these teeth to deal with the diet that he had. Whereas over many millions of years, our diet has changed and we no longer need to have such a long jaw. But unfortunately, we still have wisdom teeth which don't have enough room to erupt into. So normally, if you've got a longer jaw, the tooth erupts straight up and down like you see here. But if the jaw becomes smaller, what happens is, I don't know if you can see too well here, the tooth actually erupts at an angle and only a little bit of the tooth erupts. And then the surrounding gum around the tooth hasn't got the capacity to be tight around the tooth as you will find around under teeth. And it's a bit like if you have a collar on your shirt which is open. It's free for food and bacteria to get in the gum area, and that's where infections start, and that's where the pain develops as well. When that happens, we usually decide, number one, we have to deal with the pain on a temporary basis, and that would involve either a course of antibiotics. Hot saline mouthwashes are good, so what that involves is taking a hot cup of water, dissolving a teaspoon of salt, swishing that around the mouth for 3 or 4 times a day. Or you can use some of the analgesics like paracetamol just as an interim measure till the infection is kept under control. Now, a lot of dentists feel competent enough to take out wisdom teeth. I, with my patients, usually refer them off to an oral surgeon. I just find in their hands, they're specialists in these areas, and they're quite adept at doing these, and the surgery is usually quite uneventful. There are some complications that can occur, but that's best discussed with the surgeon at the time. Some people don't actually have problems with wisdom teeth, and if that's the case, then they don't have to do anything about it. I have seen cases where patients of mine have come in and they're in their 60s or 70s, and they've still got their wisdom teeth embedded deeply underneath the gum line, and it's more those ones that don't erupt at all, like they're fully covered in gum. They're the ones normally that don't give troubles. If they don't give troubles, then there's, in my opinion anyway, no need to rush in and take teeth out under those circumstances. It's only once you start having problems, then you've got the propensity to continually have problems, and therefore you have to make a decision long term that you're going to be better off by taking out the tooth and getting rid of that problem on a more permanent basis. I hope this video has been of some help, and I look forward to catching you at my next video. Thanks for watching.